Hello friends, Nerd Pediatrician here. Today we're going to talk about nosebleeds and the proper way to stop them at home. Disclaimer first, this information is being presented for informational purposes only. It is not intended to substitute evaluation or treatment by your child's actual real-life pediatrician. I've witnessed so many people doing the wrong thing to stop a nosebleed, and more often than not, what they're doing does nothing at all, so no wonder they end up in their pediatrician's office. Your friendly neighborhood pediatrician is always glad to help out. The good news is, not only am I the nerd pediatrician, I'm also the nosebleed ninja, and today I'm going to be your schnoz sensei to teach you the way. But here's the thing, nosebleeds happen, they're pretty common in kids. Most of the time the bleeding is mild, comes from the anterior part of the nose, and most instances do not require treatment like nasal packing or cautery. Let's talk about causes. Why do nosebleeds happen? So the number one cause, we call that digital trauma. There's an old pediatric joke about not asking kids if they pick their nose, but rather, hey, which finger do you use to pick your nose? Another common cause is mucosal irritation. So the skin inside the nose, that we call mucosa, is very thin, and right below it are a bunch of blood vessels. So anything that irritates that skin can increase the risk of nosebleeds. Things like low ambient humidity, very high temperatures, very low temperatures. Also, if your child is sick with the common cold, that nasal congestion can cause inflammation, which can again lead to increased risk of nosebleeds. Another thing that pediatricians always have to consider is a retained foreign body in the nose. And no joke, one time I pulled a frog out of a kid's nose. That's a story for a different time. Very rarely systemic illnesses can cause nosebleeds, or nosebleeds can be a sign of those illnesses, but don't stress, we'll cover when to worry about those in a bit. Now, a quick caveat, nosebleeds in kids under 2 years of age are relatively uncommon and should prompt consideration of an underlying illness or trauma, whether that's intentional or unintentional. Okay, what to do when your child has a nosebleed? First things first, stop the bleed, but first things first, chill. Your child will feed off of whatever energy you're showing them. They're likely already freaking out themselves because blood is coming out of their face. So model that calm behavior to help your child calm down as well. Next, have your child lean their head forward and down. What's that, Dr. Nerd? Forward and down? That's right, not up and back like we were taught as kids. Why? Well, it's simple. You want the blood to flow forward and out of their body, not back into their body to be swallowed. Trust me, nothing makes a GI tract less happy than a belly full of blood. And do you really want to be cleaning up bloody vomit? Next, apply pressure to the soft part of the nose with the thumb and index finger. You can do this yourself or have your child do it. This is the part that I see people get wrong the most. What they do is apply pressure to the bridge of the nose, and that does nothing. We call the outside of the nostril the ala. We're just going to call it the squishy part of the nose. So thumb and forefinger, apply pressure to the soft part of the nose, head down and hold. How long? I'm glad you asked. A long time. You want to hold pressure for 10 or 15 minutes at least before you check. Don't be tempted to let go after a minute or two to see. I assure you that nose is still bleeding, and all you're doing is setting yourself back in time and how long it'll take to stop. Here's a bonus nerd hack you can try. You can apply an ice pack to the bridge of your child's nose. This can cause the blood vessels in the nose to constrict, thereby shortening the length of the nosebleed. Maybe. Let's talk briefly about when to freak out. So if your child has a prolonged nosebleed that does not stop using the methods that we just talked about, especially if you've tried holding pressure for 30 minutes or more and they're still bleeding, that's the time to seek immediate medical attention. Hopefully it goes without saying, but if your child is having difficulty breathing, if they've passed out or look like they're about to, bring them to medical attention right away. And finally, as I mentioned, rarely there are systemic illnesses that can cause frequent nosebleeds. If your child is having frequent nosebleeds, if they're hard to control, if they bleed easily, like bleeding gums from brushing their teeth, or they have a lot of bruises, please discuss with your child's pediatrician. To help you remember all the steps to control a nosebleed, I have composed an original haiku. Nose need to panic. Grab that soft schnoz and hold tight. Lean forward, not back. Follow the advice of the schnoz sensei and you'll be on your way to becoming a nosebleed ninja too. If you have any concerns about this, make sure you talk to your child's pediatrician. And remember, if you keep your cool, your child is more likely to stay calm as well. Thanks so much for watching. I hope that you'll consider subscribing. Have a great day. Nerd Pediatrician out.